Okay, so welcome everybody. Good evening and welcome to the monthly Black Voice Hertfordshire community meeting for February. We are pleased to be hosting many leaders in the community today, as well as members of the public. In today's meeting, we will be discussing productivity related to everything that we have previously spoken about regarding leadership, actions related to authority, solutions to the issues within education, and raising the issues experienced by the Black community within health. Before we begin, here are a few things to bear in mind. All of these meetings are recorded for transparency. Respect must be given to all participants of this meeting. Although we're aware that conversations around racism can be political, we would not like this to turn into a debate between the actions of different political parties. Rather, we would like collaboration between everyone to reach a common goal. When referring to the Black community tonight, please refrain from using the terminology BAME. And Black Voice Letchworth is on many social media platforms. Please come and connect with us. We are on Facebook, Tumblr, Pinterest, YouTube, TikTok, Instagram, and LinkedIn under the name Black Voice Letchworth. On Snapchat and Twitter with the username @BlackVoiceL. And we have a website at www.blackvoiceletchworth.com. Our contact number is 07581 720032, and our emails are blackvoiceletchworth@gmail.com and bvlinquiries@gmail.com. All of the places where you can find us online will be posted into the chat. A link to a form where you can provide feedback about Black Voice Hertfordshire community meetings will also be in the chat. If you don't receive our reminder emails for Black Voice Hertfordshire or the minutes and recordings of these meetings, please feel free to use the other link in the chat to tell us your email address. This is not mandatory, but there are quite a few people who attend that we don't know how to contact. Now I'm going to hand over to Michaelia to provide an explanation for who Black Voice Letchworth are, as well as some additional information about the meeting tonight. Thank you.
Thank you, Amy. I'll just share my screen with you. Okay, can everyone see that okay? Right, welcome everyone to the Black Voice Hertfordshire community meeting. The Black Voice Hertfordshire community meeting is a Hertfordshire platform for the Black voice specifically to be placed in the presence of those who hold the power to implement permanent, ongoing and productive change in areas of disparities affecting the Black community. Who we are, move this around. Black Voice Letchworth is an unincorporated organisation founded by Michaelia Clark, together with a group of like-minded individuals locally and beyond, have come together to support those of Black African and Caribbean heritage and those raising children of Black African and Caribbean heritage within community under the BVL 4 pillars: history, culture, creativity and support. Our main aims: to fundraise for the UK's first Black History Museum, Library and School of Cultural and Creative Arts, and to support the Black community. Our story: 3 years ago, I visited my local library to take out some books on Black history to teach my child at home. There were only 4 books on slavery found at the library itself and 0 books on Black history in all of Hertfordshire libraries. After becoming a mother, I continually experience unhealthy incidents of racism and discrimination in its many forms, but ignored it. Following the recent death of George Floyd in America, it made me think about my own child's future. I decided to use my skills to open the National Black History Museum, Library and School of Cultural and Creative Arts and create a group, a local group, Black Voice Letchworth, to support those of Black African heritage in my own town and beyond. My computer is going to do its funny thing again where it doesn't respond. I think this is it. Okay. Yes, okay, it just catches up. Okay, so our services include the Black History School, which include the One Woman Black History Show, the Black History School Online, Mama Sugar Shake's 0 to 5 preschool program, Black History Online course 18+, BVH Awareness and Accountability Dossier, Black History Virtual School Pack, Black History Children's Book, online library and bookstore, online museum and online magazine. Supporting the Black community. Our services include our monthly Black Voice Hertfordshire community meetings and birthday initiatives, weekly kids STEM gaming group, all-round health and wellness support classes, talks, groups, workshops and courses, documentaries, films and radio projects, legal support and advice, Hertfordshire Black Business List, community action support and accountability group, building relationships with other organisations, and the Al-Kubalan Festival. So tonight's agenda is productivity on leadership, actions on authority, solutions on education, and issues on health. House rules, please remain muted at all times. Please use the virtual Zoom hands up button to give notification that you would like to contribute or write your question in the chat box. Due to the specific nature of this space, please refrain from using any and all known and unknown ethnic group acronyms and words. Please wait for a contribution to end before you contribute. Raised voices or voice over a contribution is not permitted. Please do not swear or use foul language, and please place all contact information, events, projects, and your organisation you wish to share in the chat. Issues, actions, and solutions. Each agenda discussed goes through an issue, solution, and action test to ensure productivity from issues raised. The last hour will be given to the floor for a free discussion. Save the date. The next Black Hertfordshire community meetings will be held, it will be held on Friday, the 26th of March, 2021. So you can save that date now. Volunteers required. So we take volunteers ages 16 plus. Volunteers are required. You can email us at blackvoiceletchworth@gmail.com. And thank you for listening. So today, where our main subject is health that we're talking about, and I'll give the floor to Glenn and Amy now, who will take over our contribution today to start our discussions.
Good evening and welcome to our community meeting, Black Voice Letchford. Now, mental health really, it's a topical issue at the moment, and you know it can be viewed from many different perspectives. But I think for this community meeting, right, we're going to look at it really through a certain spectrum, mainly looking at it, you know, the sort of control, dangerousness and control aspect, and the, you know, sort of less than aspect really. So I tell you, Amy, I'm wondering if we, you know, we can go to the slide, and I'll sort of.
Yeah, I'm just waiting for Michaela to give me sharing permissions, please.
Yeah.
You now have sharing permission. Thank you, Amy.
Thank you.
Yes, I think we'll go to the second slide mainly. Yeah, so I think one of the idea that when we look at in terms of mental health really is the sort of the Mental Health Act that is actually used to sort of give care and treatment to, you know, to individuals who are suffering from mental health. And one of the the main way in terms of how it's been interpreted, it's when individual one is seen as through a sort of a risk, an understanding of risk and what risk really is. And, you know, there are three main areas that sometimes they look at. They look in terms of risk to their health, risk to in terms of others, the public, or risk to themselves. For us to really understand that, we have to understand in terms of what is actually seen in terms of dangerousness. And one of the way in which we can understand dangerousness is when we look at the concept in terms of what you know, like our prison population, as to how sometimes dangerousness is being interpreted. There are normally, there's a link below the site to actually help you to sort of get some more insight. I've just taken just, you know, part of, you know, that that sort of you know, presentation to for us to help to understand what dangerousness and control is really. For health, like physical health, when we look at physical health, generally individuals, if they need help and support, they're not taken by the police, right? Or they're not actually locked up in terms of a hospital. But when you think of mental health, one of the big aspect there is, you know, the police is heavily involved there because of the idea of dangerousness that has been linked to it, really. And, you know, and some of the media presentation of that situation of people, you know, either hurting themselves or hurting individual, dangerousness has been linked a lot to mental health. So you have, you know, where individual has to be placed in a place where it's secure, right? Or they have to actually be, the police has to be involved in order to give that care and treatment. So that's one of the way in terms of us to understand dangerousness. If we can go to the next slide, Amy.
Yeah, sorry. I'm
The next slide. Yep, thanks. Okay. Now, I've gone back in history here to give a glimpse of something. I'm not sorting in terms of, you know, if we are familiar with the Dred Scott decision, in terms of where the Supreme Court had, you know, there was a gentleman, Dred Scott, who his sergeant, who was his slave owner, after he died, and he was basically in a city that was seen as free, where he went to court to try and say that obviously he's a free man. And the Supreme Court made a decision then, a significant decision, and I'm just drawing out just a brief reference to this, where it was seen that obviously slaves during that day, they were not seen as citizens, right? Or they were seen basically as less than. Now that is across the Atlantic. If you come closer to home, Amy, and that was in 1857. If you come closer home, we understand a similar sort of thinking also, right? Where a group of people, mainly slaves who were Black, again, they were seen as property. They were seen as less than, right? And, you know, obviously we understand in terms of the Zong massacre, you know, when, you know, slavers were bringing slave on a ship, and then they throw them overboard because obviously there were a lot of slaves and things like that. And that case was taken to court, and, you know, a judgment was also made, right? So that's another idea. So one of the first idea is the idea of dangerousness, the idea of less than status, to see exactly what that is. And if we go to the next slide, one of the other aspects that I want to bring in here is wealth, right? And individual rights, and, you know, education, because those things give individuals the power to access help. the power to actually, in terms of do things, the power to make change. And if somebody doesn't have rights or somebody is unable to access those things, it puts them more in a vulnerable position, right? And, so the whole aspect, even when you look at a group of people who, one of the issues that we have is the the disproportional representation that we have of a group of people, whether be it in the prison system or in the mental health system. We're focusing now on the mental health system. And this is a problem that a lot of people have been trying to understand. Why do we still have individuals who are disproportionately represented, right, within the system, either, in under whenever they're being detained, right? And there are many aspects that we can understand. So one of the first thing is what I've mentioned before, for us to have a thing in our mind, to keep in our mind, the aspect of dangerousness. The other aspect in terms of to keep in mind is that of less than status, right? The aspect again is, where individuals do not, have that sort of, access to make that decision, their rights, their wealth, or education, where a group, in terms of, the intergenerational transfer of wealth or educational rights, seem to be disproportionate to one group of population. Amy, if we go to the next slide, please. Thank you. All right. Now, I've drawn reference here because one of the main ways, which, as I said before, is where care and treatment is given to, to people who are experiencing mental health problem. And, a lot of studies have been done in terms of the section 135 and 136, right, are parts of the Mental Health Act, where, the police is actually involved, right? The 136 is where the police can remove somebody from a public place, right, to take them somewhere to give care and treatment. And, also the 135. Now, we understand, even since the the Mental Health Act came into modern sort of inception in 1983, right, we have seen over this period of time where there has been a disproportionate representation, and there still is, right? Amy, if we go to the next slide also, please. Thanks. Now, also, when we look at in terms of hospital stays also, we have a group of people, right, mainly Blacks and African Caribbean, who are disproportionately represented there, and they have longer stay, right? They have harsher in terms of in terms of the medication, more sedative medication, longer stay in hospital, and it's also disproportionate also, right? And this is one of the phenomena that, it seems as if we haven't really got wrong in terms of addressing, right? The next slide, Amy, thank you. Now, there has been changes that, it's a problem that has plagued our society, our community. And there have been individuals who have tried to, look at it in many different ways. And one of the changes that had come about, really, to try and see if we can address it, was when the Policing and Crime Act was sort of modified, or there were changes in the Mental Health Act there to have these changes where they have, in terms of, instead of staying in 72 hours in police custody, then it was 24. So they reduced the amount of time. They reduced also, where they can actually, sort of detain people, right? And they try to refine the sort of rules there, and the policies, the procedure and the laws, to try and see if they can address the problem. So that has been one attempt to try and see how they can actually address the problem. Amy, if we could go to the next slide. Right. Also, if we look at in terms of from the medical perspective, they have given guidance as to what should happen in these emergency setting or these emergency department to try and address that problem. Right. Also, so you have the police making changes, you have the health sector trying making changes to try and see if they can address this problem of this overrepresentation of individual in sort of a mental health setting, or that have been detained or in this setting. Amy, if you go to the next slide for me, please. Thanks. Now, there has been an independent review of the Mental Health Act to try and see if they can address this problem, because that's one of the main hub in terms of how people are given this care and treatment, within the legislative framework. And one of from a lot of the reviews, they're trying to see if they can change certain criteria as to how you go about detaining individual or assessing individual. And they've identified 4 main areas, right? Now, this has not come into place yet, but that was some of the suggestion that came about from that review, right? That people can have choice and autonomy, least restrictive. We can really identify what would be the therapeutic benefit, right? And if people, and we need to treat people as individual. So those were 4 broad areas that they've identified from the review as to, to form part of the hub to make these changes. Amy, if you go on to the next slide for me, please. Thanks. Now, I've drawn from, in terms of, when we look at race equality and some of the aspect in terms of, why are these disparities, and trying to look at the literature and the evidence that are actually there. And, there are many suggestions there coming out as to why we're having these disparities, right? Obviously, one is, there's mistrust, right? And if you go back from what I've said from the beginning, there's mistrust among a particular group, right? Sometimes, people who are detained and the treatment modalities that are being used, it's not sort of specific to those individual group, those cultural group. The research, some of the research that has been done in terms of for the treatment, right? It's not actually taken into consideration of those of certain culture, and a lot of research have not been done into these culture. So, those are some of the aspects that have been there. Amy, if we go to the next slide, please. Right. Now, the government has also tried and put certain things in place, to see if they can make some changes to this. So, you have, recently they have changed in terms of, the framework to try and address. So they've put in place in, I think in September, for a new sort of community mental health framework for adults and older adults. And they have tried to make it, a little bit more, community oriented. And one of the things that I've actually, if we looked at that framework, right, it is showing us that really and truly there is some arguments there for us to really look into the issue and look into it more seriously to make these changes and actually engage in a particular group of people to actually see how well we can understand the problem and what would be the best approach to it. Amy, can I go to the next slide for me, please? We'll have some questions at the end, Tracy, right? Just make a note of it. Now, also, I'm just going to stay shortly on 2 of the other aspects. So you have, in terms of, there's also, this is a government initiative in terms of, to have a long framework in terms of to look at the problem, right? And what intervention they would actually put in place. The information that is on these slides, it can be made available to you also, right? So at least you can look at the information for yourself also. Amy, can we go to the next slide, please? Now, from the independent review that was done in 2018, right? They did an impact analysis assessment to see exactly in terms of the Mental Health Act, in terms of reforming the whole Mental Health Act. because they realize that obviously this is what is used to give the care and the treatment, right? And they have come up with in terms of a number of things, areas in which they're thinking that they need to reform, right? And one of the main area is how they can strengthen the patient voice, right? How they can have new sort of detention criteria, how they can improve the support for people who are sort of detained, right? And the community treatment order, which came into place in 2007, right? They want to see exactly how they can actually revise that, because that is also one of the area where you have this overrepresentation, right? And how they can treat people from the Black community. Amy, if you go to the next slide for me, please. Thank you. Right. And then we have the white paper, right, which came into place in January. And this, one of the things I would really like to note from what was said in that review, right? And this is very interesting, right? And this was in 2021. This was one of the main statement that was made there. And I'm going to read it out. When I started my career in psychiatry research, right, one of my main earliest paper back in 1989 was on the subject of the overrepresentation of those of Black, African, and Caribbean heritage amongst those diagnosed with schizophrenia. Not surprisingly, this excess was also seen to an even greater extent in those detained under the Mental Health Act. Now, 30 years later, it is sad to record that little has changed. And this was one of the things that in terms of that has come about in terms of to say that even after, we understand that there has been this overrepresentation, right? And nothing has actually changed in that sense. With all the changes that has happened, it seems as if we haven't really moved a lot forward, right, to address the issue of the overrepresentation. So it has still been a problem, and it is still a problem with us. And how do we actually address it? How do we go forward with it? Amy, can you move to this next slide for me, please? Right now, one of the aspect is where the early intervention, early aspect, where in terms of access to psychological treatment, right? There's been one in terms of initiative that was done in 2017 by a group, the Birmingham Healthy Minds, where they've tried, in terms of for particular group to do psychoeducation and tackle, the physical health also, right? And also use different approaches to help individual. And, there has been minor benefit, but it seems as if it still didn't change much of the problem in that area, right? For the overrepresentation. So what do we actually do? Amy, can you go to the next slide, please? All right. So I've just mentioned here a couple of the things in terms of, to see exactly how can we actually go forward, what can we actually do in that sense. Media has played a significant part, right? So how are we able to shift those narrative? How are we able to give care that are specific, right? Specific to particular community, right? How do we get practitioner from those group to actually help out within those community, right? And education in terms of to help with that destigmatization, right? Amy, can you go to the next slide for me, please? Thank you. Right. Some of the thoughts I want to actually think is that, we cannot forget history and how it has unfolded, right? Right. And we cannot blind our eyes to what the current problem is, right? We all have a responsibility to do something, right, for the betterment of our human race, right? And we need to get involved. This this link here, I want to actually also for you to actually take away and be part of the consultation, right? Because there is a problem. Get involved, spend some time and fill it out, and then hopefully would be able to see exactly what contribution we can make for that change. Okay. I think what I'll do now is just, you know, finally, in terms of, there are at the end where there's some resources that you can actually use in terms of to help with in terms of with mental health or to share. And I think I wouldn't actually speak a lot more. I'll leave for, you know, if we have room for any particular question there. I know we've got the last hour set aside. Michaela.
Yes, Glenn. Yeah.
Yeah. So I think what I wanted to say is that, you know, if we look in terms of from how we've actually gone through, how I've gone through in terms of the presentation and the spectrum I've actually used, it's okay for you to actually use this slide, but also to remember in terms of how I've actually looked at the problem. There are many, as I said before, there are many ways you can actually look at the problem. But if you just have a think in terms of how I've actually looked at this problem for this particular community, right? And, you know, if you want to actually share from the slide, if you remember that, and actually, you know, so at least you represent the ideas that was actually passed on. I would think if there are questions, I'm sure that, you know, I'm not certain how much time, if any question for that, or if you want to leave it for the last hour, I'll leave that.
I just wanted to, we'll have questions definitely at this point, because I think some people wanted to ask some questions and contribute. I also wanted to say, I don't think I mentioned in the presentation at the beginning about our dossier. So the Black Voice Hertfordshire community meetings are putting together a dossier that we're going to make available for people, organizations, businesses, institutions in various sectors, so that they can have informed information from the Black community, from professionals on the disparities, so they can implement policies within their organizations, etc. So basically, these contributions that are given by Glenn, mental health professional, by voices within the community, experiences to how you tackle the disparities and the targeting, etc. issues within the Black community. So this will be one of our resources, and I'll be sharing another resource as well, but that's on a separate agenda. And then I will give the floor back to Glenn for questions on his wonderful presentation there. Una, do you want to let us know?
Yeah, it's Tracy. Tracy, if you'd like to unmute yourself, thank you.
Hi, can you hear me? Can you hear me?
Yes, I can hear you.
Hi, Glenn. Thank you for the presentation. It was excellent. Thanks for your time. I was just going to ask you, I mean, it's such a complex area, and actually, you know, yes, it's particularly acute for Black people, but it's everywhere and anywhere, and age is relevant. It's particularly now. But I just wondered, you spoke about a lot of the acts and lots of indications of need for change and people recognizing that. What actual, from your point of view even, what actual steps could practically be taken to improve, you know, not just Black people, just anyone who comes into this system, and I guess I know the focus is on Black, but just anyone who comes into the system in distress and ends up in care, what are the practical steps that can be taken realistically to change things so that outcomes are better or improved longer term, if there are any that you know of? Yeah.
Well, there are steps that can be taken. Some of the steps would have to be taken before people actually come into crisis. Some of these steps also, because when an individual is actually in crisis and they are unable to actually make that decision, there need to be a system to be able to help to make that decision for them so that they can get the proper care and treatment. Now, part of it is the cultural aspect, how you actually, when I say cultural, I don't mean Black or white, I mean the actual practice. When somebody is in distress, you you have to take every care to actually lend a sort of compassionate sort of approach, an approach that would inevitably not traumatize them more than they're already traumatized, right? And in most cases, those things that it is being done. Part of the culture is that, is how we interpret risk, because at the end of the day, it is risk that we are seeing, and it's how we interpret that risk, how we see that risk. And in some cases, the risk is interpreted differently based upon who is actually being presented, right? So, and that's one of the complex problems. That's one of the big problem. So you find generally, people would be, it would use in terms of to use all care to ensure that people are given the best care. One of the shifts that has been made, which was good, is that people are less likely now to go into a prison cell when they're in those distress. They go, particularly in terms of hospital. That has been one of the change that has happened in 2017, right?
Has that come through police training?
Because the police is the main individual who actually, go and act with the law there. Obviously, you have at times when you have a health professional need to be with them. That's in the 135. So in the section 135, there has to be a doctor, there has to be an AMP, and there has to be a police. But in the 136, it's the police who have to make a decision that sometimes is, of a medical nature there, right? And because that is their remit in that sense, but it's not for the medical aspect. So one of the changes that has been made is where they get that care. The other change, as I said, is how long they stay within that system. So instead of 3 days, 72 hours, they've cut it down. So that was one of the chair. So in terms of how you deal with those individuals, and in terms of the system. So one of the changes, try and change the system, right? And where they go, and who did they have to advocate for them?
Yeah, I get that. So it's kind of a level of compassion from the police being made to be aware that they need to be more compassionate and understanding of cultural differences. So the interpretation of somebody's behaviour, word, what they might say, if you can't put that into perspective of how one culture might communicate, I guess if they better understand that perhaps something that might be perceived as being aggressive or maybe even violent, but understanding it in the context of that culture. And I know that sounds a bit weird, but I guess if they don't have that time to appreciate that, okay, this is going to be slightly different. This person doesn't mean to be aggressive. This person doesn't mean to be, whatever. And it's understanding or having compassion to understand what they might be going through, not instantly react with violence or assume the violence is through intention, but just frustration or whatever it is that person is going through. So I guess it's kind of raising the level of awareness of how people might behave or how a culture might be, and being softer or more understanding, and before making a rash decision as to how to deal with that person.
Yeah, and an increase in the individuals from those culture being, more in those sort of position. One of the other changes that they've actually made is where you have health professional are also embedded in the police, right? To actually,
Is that happening?
Service.
Is that happening?
Yes, that's one of a new initiative, really, that is taking on at the moment to try and see exactly. So you have more of a medical view also with the police.
I think I could imagine that making a big difference. That even if somebody came into, from what I've heard, I can imagine somebody who is in distress. A policeman who hasn't got time, just needs to deal with the situation, and perhaps ordinarily would it could escalate, as opposed to perhaps that person seeing someone of their own culture, colour, whatever it is, and that pacifying them because they feel like that person might better understand what they're going through, or at least be compassionate towards them. So yeah, I guess that must help a lot.
Yeah. One of the downsides there is that you also have that there's not a lot of in terms of datas, that the collection of data and the type of data being collected, you know, it's poor in some respect. I've seen that there are a couple of more hands there.
Yeah, so it's the user with a YA. Yeah, if you'd like to unmute yourself and ask a question, thank you.
Okay, yeah. So yeah, my name's Malcolm. I'm a mental health worker myself. I'm a team leader for the wellbeing team in Hertfordshire. So I just wanted to say it was a really insightful presentation. So thanks, Glenn. But I also wanted to say something about the solution, because I noticed in the services that I run, there's an underrepresentation of people from minority groups within the services that we run for primary mental care, primary mental health. So primary mental health affects people, 1 in 4 people in the population. So people in this forum is going to have a primary care mental health need, just like someone might have diabetes or a physical mental health need, for example. It's kind of equivalent to that. So the underrepresentation of people from minority groups within the services that I run, if they're not accessing the services at the early stages, when you're talking about mild to moderate levels of depression or anxiety problems, then it's likely to get worse. And that's where you get an overrepresentation in secondary care and tertiary care mental health services. So in terms of a solution, the reason why I came to this forum today is to try to find ways to allow people from minority groups within the Hertfordshire community to access primary mental care services, so it doesn't get to that point when they have to access secondary care mental health services, sometimes not through their own volition as well. So I did see that you had one slide there about the NICE guidelines there and psychological services. So just wanted to kind of put that out there and see if there's anything we can do really, or maybe I can put a link or something like that in the chat, links to our website so people can self-refer and can put the word out there. Don't know what you guys think about that.
Yeah, well, and that is true in terms of the early aspect, in terms of where, the Black population group accessing help. As you said, sometimes if there isn't that early access of help, then you have some overrepresentation. And that is one of the angle in terms of where you get that. But one of the other aspect to that is where there has been that cultural mistrust.
Yes,
right?
yes.
And because of that cultural mistrust that is there and that has been perpetuated, you find that it is harder for the Black community to seek that help early. One of the other angle to that also is where, and this is, it is from the research, and I've put that part, part of that also in the presentation, is where you have in terms of, from the Black community, and there are other aspects in which how they view mental health. And you find that sometimes there's not a lot of research into that aspect. And because of that, the intervention that is used earlier, sometimes for that community, right, is not, it's not always in terms of appropriate for that community. So I think there need to be more research in terms of a solution as to what actually helps that community, or how that community can be helped in those ways really, or what really benefit, or how do they see the problem, they actually view the problem, and what can actually be done to help. And that is another angle that can actually, be used really.
Yeah, and I suppose there's a lot of stigma. In addition to that, there's a lot of stigma in some minority communities as well towards mental health, and maybe accessing services like the ones that I run, they might have the wrong idea about that and not realize that it's actually going to be not going to be an intrusive form of therapy. It's going to be a psychological therapy, a talking therapy, which they can engage in out of their own volition completely. It's their will, and if any risk is identified, it's to protect themselves or others around them. So it's a sort of a different level to secondary care ones, and the parts that you touched on with the sort of like forensic mental health and secondary mental health.
Okay.
I think we've got another hand there.
Yes, it's Sonia. Sonia, if you'd like to unmute yourself and speak.
My comment is to Glenn, a wonderful presentation. I'm from Wiltshire, and I would like to ask, how do we prevent our young men and women facing racism at schools and mental health? Is there any stats available? Because I am finding a lot of our children who are victims of racism are suffering from post-traumatic stress disorder. Is there any stats available so I can show the local authority and the police?
Yeah, there isn't, and in terms of stats, in terms of, the racism in terms of at school, really, right. But it is an issue. One of the things that we have seen is that there has been an increase in terms of a number of young people presenting to the mental health service.
Yeah, we have.
So there has been a lot of emphasis on the child and mental health services and working with schools and with also, as they are called, camps. So there have been a lot of initiative to actually help with that. And but we know that it is a problem. So one of the things in terms of, I think it's really that we need a little bit more stats really from specific to that. Education again is one of the issue there, and always raising it with the school, because that's one of the way. If we keep just doing it informally, then there isn't a lot of records of it.
Yeah, okay. Because we are finding it hard, despite the schools having their own equality and diversity policies, they're not adhering to them.
Yeah.
And it's causing a lot of pain. I mean, our youngest victim is 4 years old and she's self-harming at 4. The only thing a 4-year-old should be worried about whether her next unicorn is going to be pink or purple, not self-harming. So where will she be in 10 years' time?
Yeah, it is an issue. It is an issue. Sadly, it is an issue. I'm sorry to hear that, because that's a young age. A childhood. That is being affected in that sense. A child is supposed to be enjoying their childhood, really. But it's one of the issues that is actually, sort of affecting us, really, affecting the community, and affecting the wider community also. It is going to be a problem. It's something that is for all of us. And when I say all of us, I mean black, white, pink, everybody, to actually, take some action on, because it is an issue. It is a big issue.
Very good. Thank you. And thank you to all of you for listening.
I would like to pose the question that we had submitted via email, if I may. Amy, do you have that question to hand? It's from one of our councillors with regards to the COVID vaccination. I don't know if anyone is aware, but within the Black community, there has been some reluctance to take the vaccine, primarily due to trust of it in general. I think generally the Black community tends to be quite not trusting of well, yes, definitely the medical profession, but in general, just any sort of institution really, because of, well, you know, the reasons why. The question was with regards to the giving out of the vaccine, that we're not being made a priority to have the vaccine. Did anyone want to contribute on whether or not the Black community actually it has concerns about that, it not being a priority, whether it should be a priority for us because of the numbers and deaths, etc. Does anyone want to contribute along?
I will say something, because here in Wiltshire on Thursday we're going to have a big conference, and the topic of the conversation is the BAME community and conversations around the COVID vaccine. And we've got a lot of misconception, myths. People are listening to Joe Blogs, who's got his information from Facebook. And I find it frustrating. I who have family who are in the NHS on the front line. And here in Wiltshire, only 2 weeks ago, our first BAME nurse died from COVID. So I say to all the people down there, the vaccines have been tested, okay? People have had the flu jab, the measles, whooping cough. The vaccine has been tested and it has been trialed. I've read the data, I've looked at the data, I've sat in with the public health meetings, and the problem is what they're saying for a lot of the BAME community that we are front line working. We use public transport and we are living in houses of multiple occupancy. And they put that down to the reason why I think it's 4% more likely for a BAME member of the community to be affected by the COVID.
No, I just make a correction, just to focus on the Black within that, because just to, that tends to get, well, you know, the history. Yeah.
And that's what they have said. And that's one of the things we in Wiltshire are combating. We've got posters and it's not easy. And what, you know, in fact, that's the very same poster we've got out there. We've got that in various formats for our community to go out there. And we've got people going out, literally putting posters through people's doors. We're targeting young and old, and we have found there is a low take-up rate because people do not trust the vaccine. And it goes back to slavery, where slaves were tested with the vaccines. And I think it was a syphilis vaccine where Black prisoners in America were tested on the syphilis vaccine. And that is, people have a lot of stigma and a lot of things that they have to move forward and leave the past behind. And that is my concept. That is my impression on the vaccine. There'll probably be somebody out there who can say more, but I would say, please take the vaccine. And if anybody's going to ask, yes, I have had the vaccine and I'm still here. And no, Bill Gates hasn't put any microchips in my head.
Yeah, trust is definitely an issue. It is definitely an issue, and I think we need more in terms of, you know, to keep encourage and education, and, you know, people make decisions for many reasons, right? But I think it's something that we have to keep encouraging. You know, I think I'm a medical person. I've had the vaccine, and my encouragement would be to have it also. And I think we need to, you know, different people would say, you know, they won't. Some of my friends say they won't. Some of my friends say they would. But I think we need to keep, you know, spreading that word, because we got to be protected, in that sense, really. And millions of people have had it. It has been tested. Vaccine has always been given, you know, in the past. So we'll have to actually spread some of the positive words, some of the evidence that is actually there in that sense. And other people will have their different view, right? So sometimes we have to hear people's view, even though the view might be opposite to us, right? We have to hear them and share our view. And my view would be for them to take the vaccine, you know, while I still hear people who don't want to take it.
Hear, hear.
Okay, we've got Elizabeth next with a question. Okay, Elizabeth.
Lovely, thank you so much. I think I'd like to echo very much the points that Sonia and Glenn has made. There are entirely understandable reasons, I think, why certain members of the Black community, for cultural and historical reasons, might feel that they're not comfortable taking the vaccine. And the challenge for us, whether we're in local government or health authorities or supporting them as community members, is overcoming those barriers and sort of breaking it down and going, this isn't the past, this isn't the slave era, this isn't even the mid-20th century when the medical professions treated you absolutely abysmally. Councillors were able to attend sort of one of the regular briefings that Herts County Council delivers today on COVID and sort of next steps. And I don't have the Black community specific data, it's just the sort of non-white white split, Michaela. But in that split, in Hertfordshire, there's an 11% difference in the white versus non-white vaccination take-up. So theoretically, it's de minimis for this area. But bearing in mind that Hertfordshire also borders and comes quite close to London, in London, non-white communities are 40% behind the white community in accessing and taking up the vaccine, which is shocking when you think about our friends and family and colleagues who are going to be crossing those particular county boundaries and the sort of overall global community work that needs to be done to get everybody to sort of buy in to this. I don't have the answers and how we overcome those barriers, but what I will say is that county council is aware, district council is aware, and what we need to do, I think, as leaders and influencers is come up with a strategy working with the community for how we can engage people and overcome those very, very valid cultural, historical reasons why people distrust white healthcare, because it is not okay that stuff happened, and we've got to find a way to support each other to move through it. That's my contribution.
Okay, thanks, Elizabeth. And again, it's user Hawaii. Thank you.
Hi there. Yeah, I think that's a really interesting point. But I think it's not just historical reasons as well that there's a mistrust within certain Black communities. I can talk from the Caribbean community because I'm from that community myself. And there was a thing going around on social media from a Jamaican politician who was discouraging people to take the vaccine if they're living in Jamaica, and let other bigger countries like America, Canada, and the UK take the vaccine first before they take it. So it's still a current issue as well. There's historical underpinnings to it, but there is still a current issue. And I think it kind of relates to people that sort of need the healthcare the most, whether it's mental health or physical health. They're the least likely to access it. Yeah, so in terms of mental health services, I think there's a big need from the Black community for different types of mental health in primary care and in physical health as well, especially with the COVID vaccine, but they're least likely to access it. So it's a need to get the services out there into those communities to let them know that they're available and try to encourage them.
Okay, thank you. Next person is Sue. If you'd like to unmute yourself, thank you.
Hi, yeah, I just wondered on this subject whether people think it would be better to have more information about Black and ethnic minority low take-up of the vaccine. You know, one of the things people have asked me is, well, who exactly are they talking about? Are they talking about, you know, Black people, Asian people? What are they? Who are they talking about? Are they talking about people from religious groups? Are they talking about people that live in Letchworth or in Watford, or, you know? So I wondered if people think that would be helpful to have more data and more exact information about who we should be talking to and encouraging to take the vaccine.
Can I contribute to your question, Sue, if I may?
Yeah.
If before I do that, if I go back to Councillor Elizabeth Dennis-Harberg's contribution, I've heard contributions from quite a few leaders in media and locally about saying, you know, voicing that they understand the reason why the Black community is reluctant to take anything medically from a majority white medical system. But that we've moved on from that. Unfortunately, we haven't. It's still there. We're still being victimized within the medical system. It's not geared for us. I know to some people, maybe because we're not being injected with syphilis, it seems like it's all better now, but other things are happening, like women when in the maternity having their afterbirth left within them, like well, Glenn just went through the whole mental health issue there. Like me being told that my womb is a different shape because I'm Black than a white woman's, that's why I suffer with period pains more. Things that, this is just a doctor in Baldock when I lived there, telling me that, a female actually, and I had to ask again and again. She said, yes, it's fact that your womb is shaped differently. That's why more Black women are prone to period pains. So it's only because my mother is a nurse and most of my family are either lawyers or in the medical profession. I had to go back to her and she's like, that's a load of rubbish. We're all kind of the same. So that kind of it's still going. We're dealing with that. The reason why we're reluctant is because that is our life. This is a part of our life. It affects everything from how we bring up our children, how we interact with the community, everything. Because from the moment when we step out of our house, there's some sort of disparity. I can walk from my house into town and have that disparity affect me. So it's still there. And I think when that's your life, and then the institution that's feeding and forwarding that is contributing to your everyday, and it comes and it says, hey, look what I've got for you, is going to make you better. Take it, take it, take it. We just go, no, not doing that, not doing it. And yes, I understand from a leader's perspective, majority white leader perspective, they're thinking logically. They're not thinking with the influence of a lived experience of a Black person. So for them, it's logical. It's been tested. It's fine. You guys just take it. But when you're dealing with this, it has a mental effect on you, on how you make your choices. And yes, medically. I only, to this day, I remember being very young, and I only go to the doctor when you're dying. It's in the Caribbean culture that you only go to the doctor when you're absolutely dying or your leg's broken. Other than that, we use kind of herbal remedies. And that's not just because of kind of a, you know, bravado thing. That's literally, you're taught from very young that the white medicine, quote unquote, will kill you. You're taught from very young. So that's even COVID aside. So with this pandemic here, there's all of that history there. So I think that also needs to be considered from that perspective, rather than saying, yeah, we get that, but take it anyway, which I think is the air. I don't think it's intentional. I think it's unconscious because they don't have the knowledge of the cultural aspect, because they keep saying words like BAME and ethnic and grouping it all together, and not realizing that each of those specific races have their own culture, their own interactions on how they on choices that they make. For example, an Asian person would have different reasons to why they would take COVID than a Black person, because their lived experience is completely different. So you can't put them all in the same and think, okay, BAME people need to take the vaccine because BAME is not a race. So I think that also needs to be really strongly considered. And back to Sue, your contribution, sorry, I've forgotten what you were saying now.
Just about we need to differentiate between different groups of people. And I agree with what you're saying, Michaela, that if you start to lump people together into large groups of Black and ethnic minority, we don't know what that means. It creates a kind of mistrust in itself, because who are people talking about? And it's not talking about individuals. And everybody's experience is different. You know, living in London may be different to living in Letchworth, or, you know, coming from a Caribbean background may be different to coming from a Malaysian background, for example. So there's all kinds of different variations that we don't know enough about.
Yeah, absolutely. And I think that really needs to be considered. I don't think councils, when you're making your decisions, councils, leaders, politicians, parties, if you want to do anything to tackle anything within community, stop saying BAME. Stop tackling when you have, it's just going to cause a barrier for you, because mentally you're going to be thinking, I need to devise the same formula for all these separate groups, and it's not going to work. It's not. And you will constantly have a barrier.
So one of the things I'm going to do as a councillor is I attend the health scrutiny for Herts County Council. And one of the things I'm going to ask them about is, could we have more data? Because they've admitted to me they don't have the data. So they're not recording it as we speak, which I think is a real shame. And I understand how busy people are. Goodness me, they've got enough trouble finding people to roll out the vaccine, let alone record every piece of data. But this is important. So I'm going to be encouraging them to record it more exactly, to understand it better, so that we can learn lessons another time. Let's hope there's not another time, but you get my drift.
Yeah, absolutely. Yes, sorry. Una, do you want to questions?
Yes, so we've got Will next. If Will, you'd like to unmute yourself, thank you.
Yeah, I was just going to jump on some of the chat that was going on in the chat box. Lots of agreement with the idea of not being lumped together. You know, saying agreeing that this needs to change so it's not to hinder people. We've also got Elizabeth Dennis Harburg contributing that this is exactly what I needed to hear, and these are the messages that public health need to hear. So thank you. So there's lots of support for a lot of the conversation that was going on. Yeah, again, why people are being lumped into a set category, that seems to be the running theme in the chat. Councillor Val Bryan says, as a local councillor, I was listening to the Herts County Council, 11% difference between white and non-white, which I think is a statistic that was referenced earlier. I've had the vaccine due to my age, very well organised, received no side effects, and I didn't really feel the jab. And that's something that I've heard too, from having family members having the jab. It seems to be very good. So yes, and there's just a couple more reminders from Amy and Una to the use of the term BAME to say Black specifically. And Sonia's just chimed in with looking on the report, the use of how offensive it is with the use of the term BAME. If anyone has any more contributions and they don't want to put their hand up, chuck it in the box, and I'll try my best to get across them. Thanks.
Okay, next up is Amy.
Yeah, thank you, Una. I was just thinking, in regards to the, you know, using BAME and lumping everyone together, it could also be, I don't know if this is true, but in my opinion, I think that could be very dangerous, in that if you have one specific group, so obviously here we're talking about Black people, and if Black people are maybe at a higher risk of developing a particular illness or something, and then you lump that together with BAME, the statistics will get washed out, so you almost won't be able to identify that maybe there's a higher rate of a particular group developing an illness if you're just like investigating data across BAME, because statistically it would just, if you averaged it all out, it would probably look about normal. So I think there's a real danger in doing that, and it is like, you know, white people aren't put into an acronym, you know, so I think it definitely is just maybe the government just finds it more convenient. And then I think as the government's used that language, it has filtered into general use as well. So yeah, I think it's not just like a frustrating thing, it's a dangerous thing.
Okay, next up we've got Jonathan.
Thank you. I was just going to agree with what Amy said there, because I know I lost a friend to sickle cell anemia about 15 years ago, 20 years ago, and I don't associate that illness with white people. In fact, I don't even think it is with white people. So to have, again, going on about the use of the word BAME, there are certain things you just can't include in that, and it's not right. That's my 2 cents.
I think thalassemia is more associated, which is similar to the sickle cell.
I wanted to contribute an action on authority. Apologies for Simon, our support from the police, who does intend to come to meetings, but unfortunately he messaged us to say that he had an engagement, so he won't be able to make tonight. But a councillor, oh gosh, what's her name? A councillor I was contacted in Hertfordshire on from Hemel Hempstead was having a meeting with the local police officers and some health officials as well, where they're based, and wanted me to supply. I don't know if you remember a couple of meetings before, I said I had a list of 20 things that the police can do to build the relationship with the Black community, because that was Simon's request. He wanted me to supply ways in which the police can build relationship with the Black community. I have done those 20 things. So if anyone would like that, that can be emailed to you. Please just put your email in the chat so we've got that. So I've got that as well. If you wanted to have that. The only thing we ask, if you just mention BVL, because it takes a lot of time and effort and work, and we're all volunteers, so it would be great if you just mention us in your meetings. That would be wonderful. Would you like me to go through them now, or would you like me to send it all in the email when we send our mail shot over? Would that be better for everybody? Yeah, everyone's on mute, so they can't. Everyone's on mute. Right. Okay. I'm going to take that as a yes. Oh no, Sam wants it now. Sam wants it now. Oh, Sam wants it. Is that right? Sam says now. Okay. Sam North wants it now. Okay. Okay. If I can I need to bring it up. So if I can encourage a conversation on education and how we support our Black children within schools, within Hertfordshire, how our leaders can work towards that, and also on leadership, any actions that any leaders are doing to generate leadership within community, within their institutions, within just everywhere really. Any actions that anyone wanted to share, just so I can get this up, that'd be great. No actions? No one's doing anything on leadership in Hertfordshire? Really? That can't be right, surely. There's loads of councillors in here. Come on, guys. I know you guys are doing stuff. You're always tired. Every time I talk to you, your eyes are half open.
Michaela, why don't we talk about what we're doing at the moment?
Sure.
Yeah.
Yeah. Okay.
So do you want me to talk about it, or?
Yes, please, as I bring this up. Thank you so much. Yeah.
Okay, so we had an incident fairly recently at a public council meeting, which resulted in, I'm just trying to think how to word this, but quite a level of dissatisfaction with the way Michaela was treated. So we decided to take that forward, and in quite an official way, really, to have it recorded at the council, and then to look at ways in which we can work with the council in making sure that how council employees talk to people from Black and ethnic minority, or Black, actually, we're talking about Black, aren't we? So Black people, the language they use, and to make sure that there's not so much what I believed was happening in this particular meeting, unconscious bias about the way they were treating Michaela. So being dismissive, getting impatient, wanting to finish with what she was saying. We're going to be taking that forward and having a look at ways that we can improve things, really, and work very closely with the council on this. So it's really sad that it's happened. It's really disappointing, but actually it provides an opportunity for us to take it forward and do some work with the council.
Yeah. And I'll encourage that, you know, that us in the Black community who are leaders, that don't be fearful of the spaces that you're entitled to. I was for years, you know, in certain parts of Letchworth, I go shopping at a certain time. I make sure when we shop that I'm with my son very closely, because he's more likely to be looked at when he's looking around for toys. So I make sure that he's close to me, things like that. But I've stopped doing that now. I'm doing, even with my own friends, with the greatest of respect, because I personally, it's just my personal, I'm very mindful of upsetting people. However, when it's life and death for me, I know, Sue, I know. In this situation, everyone tells this is such a character flaw. But I'm considerate to the other person's feelings. However, it's something that's affecting me life and death. And if I'm in a relationship with that person, whether it be a friendship or otherwise, they have to also respect where I'm coming from also. So it's absolutely okay for me to say, you know, hold them to account, you know, what you said and what you did, it wasn't actually okay. And for them to actually, you know, think and not get angry, not get, you know, kind of combative, and just be like, right, I need to sit and assess what you're saying. Because also, I may not agree with you, but you're saying something to me and I need to value it. I need to take it on board and see what I can do to make sure that you're not harmed by something I'm doing. I think that's an action that you can do in situations, because I definitely think in these situations where we're having these conversations, that majority white panels and leaders don't believe that the majority of the stuff that Black people bring up are actually things to actually consider, you know, like, you know, life and death things. They're things to kind of, oh, that's really sad, that's really awful, but let's talk about it in a couple of weeks, let's talk about it. And I get that councillors are busy, I get that. However, just be aware that when you do things like that, it doesn't aid the relationship with the Black community. What it does is just solidifies the already mistrust, and they're waiting for that to happen, basically. You know, when I started this process, for example, people told me no councillors are going to come to that. They're not going to bother with you. They're not going to do that. Just, you know, just whittle through it. You'll be fine. I said, no, I said, I'll make them come. And I did. And they're here. Okay, they're not all here for Hertfordshire, but there are some here, and they are warriors and they are doing good work, however small or large that, you know, it is. So I'm going to share this screen with you now. Oh, gosh, where is it? Here. Yeah, wonderful. Sharing now. Oh no, not that one. Stop share. Sharing.
Just whilst you're doing this, Michaela, I was just going to jump in some of the comments in the chat. Is that okay?
Yes, yeah, go ahead.
Okay, so yeah, just lots of support for those ideas, how extremely sad it is and how these things should change for the better. That was from Una. And Sonia says, I hate going shopping as I'm aware of being followed. And Una even says that, identifies with that and is followed around shops by security guards and accused of stealing at the age of 48. So there seems to be a lot of identification with what it is that you were just saying there.
Yeah, it's not nice to be followed around. I was followed around for the first time, actually. It's normally my uncles and my brothers that have fallen around in Letchworth. And it wasn't nice to hear like a big stocky man slowing behind you going clonk, clonk, clonk. I'm like, I don't like it anyway when anyone's walking behind me. But to have someone in official police gear walking clonk, clonk behind you is like, it's not nice for, I don't know, it's not a nice feeling. It's not great. And I know some people are out thinking, oh, we just walked behind you. We didn't smack you in the face. Which I have had also, that contribution, which was lovely. But it wasn't nice. And I just recommend that if it does happen in your community, however small, report it. And if you think your counsellors won't listen to you, make them listen to you, because your voice does matter. So 20 things the police can do to build their relationship with the Black community. This is just a disclaimer that just to remember to just mention BVL, etc. So these are the 20 things. Let's scroll down here. So targeting, awareness, accountability, compassion, fairness, abuse, support, a place at the table, consideration, knowledge, relationship, communication, commitment, recruitment, complaints, protection, vision, responsibility, importance, and support. This can be added to, so if I know I'm not covering everything, so if you do want things to be added to this dossier, add it. Write it in the chat or send it via email. So targeting a specific group to their disadvantage will only affect opportunity for a positive relationship to grow. Initiate counteracting strong and clear policies within your organization against institutionalized racism. If you don't see results, change the approach until you do. Second one, awareness. Awareness training in every area about the Black community, including history and culture, is paramount. Implement this into all trainings specific to the Black community. Remember, BAME is not a race of people, Black is. Don't apply a one approach fit all to the Black community. It will not work. You must understand before you can reprimand. Accountability. Implement ongoing training in all forms of racism, not day courses. Please stop those. They're not helpful, especially the ones that are difficult to identify. These tend to be the most dangerous. Hold all forms to account and provide strong support to those that do. Meaning that if you're in a situation where I don't know, 20 police officers have worked together for 20 years and one of them decides to hold someone to account for being racist, the other 19 should be supporting him, not saying that you're letting the side down, what are you doing? So that situation needs to go. Compassion. Carrying out your duties with consideration of another human being. A zero tolerance on excessive use of force must be implemented. So I've never seen in person someone being arrested, but I'm going by videos that I've seen in recently in Hertfordshire, and I do think that the whole whatever training, however you train, how you arrest someone or deal with areas of conflict needs to really be looked at. It seems like the police officers don't have the training to always remain in control. When there's a situation of conflict and you're dealing with the public, you should be the one, because you're the one in authority. You should always have the control. So effing and blinding, effing do this, effing do that, screaming, shouting. No, it's not the way. I think someone that has literally the power to to kill you, you know, it should not be acting. It's not responsible. And, you know, it's not productive. Fairness. Ensure each officer is carrying out his or her duties without bias. Identify how racial bias works in your working environment. Train your officers on how to identify in all areas and ranks. This includes all the way up, because they tend to just train the ones that are going out, but this is everybody across the board, even the commissioner. Yes, him too. This will aid ensurance that interactions are the same for all, no matter what race you are. Abuse. Abuse of power and or position or privilege within the force should be treated severely, as this can contribute to a life or death situation. To abuse this bestowed power, it is to undermine it. If you undermine the power, you undermine the person. Support. As strongly as you are committed to enforcing the law, you should be committed to supporting those that commit it. Initiate a balance between the two within community so that trust can build. So as much as we can or should respect the authority that's created when laws are broken within our society, we also need to also have a certain trust of respect. So to know that when you do execute an arrest or carry or enforce the law, it's done with clearly and concisely without bias, so that we can build trust rather than always second guessing the actions of police. A place at the table. Give powers that will make a difference to groups created to review interactions with police to action on them when needed. This will aid for issues that may have been missed. I've been noted about a couple of some groups that I forgot what they're called now. Someone will put it in the chat, I know. But basically they review arrests and reprimands by the police. I forgot what they're called, it's gone to me. But these groups, but they don't seem to have much power really. They just seem to be a group that's just created to talk about stuff and make their recommendations, but no one really listens to it. I think if you're going to do something like that and spend the time to get a group of people together, I think they should have powers on actually making change, contributing to change, basically. Consideration of human rights in action. This should be evident in personal interactions and stats. Knowledge, education on Black history and people should be paramount. Black people have a right to be seen and valued just as much as white people are within the present disparities and otherwise. Relationship. Requesting to build relationship with the Black community, with its leaders, etc., must show commitment and be ongoing. Ghosting or going hot and cold on the community when you want something will only strengthen mistrust. And I slow down when I say that, because that I have found so far, not just with my journey with Black Voice Letchworth, but just even growing up in Hertfordshire. That has been the one thing I've seen from leadership, not just in politics, just across the board. With anything we bring up or anyone's confident or to feel to bring up about the effects of disparity, it tends to be very, very hot to the beginning. Yes, you know, that was terrible. And then you either get ghosts or it gets very hot and cold. When you send an email, it's hot again, and then it goes cold and you send it hot. That situation is just building to the mistrust. So if you do say something, even if it's a very small thing, make sure you keep that commitment ongoing. Yes, we're busy. If you set a date and you can't make that date, just send a message saying, I'm sorry, I can't make that date, but keep the flow going. Because if you just leave a dead space, the next time you come back to that space, you'll be like, oh, sorry, I've been busy. I've been away for a month. It's going to be harder for you to infiltrate because already they've built up this wall. So make sure that commitment is ongoing and supported, even if you are busy. And communication, aggravated language and behavior, swearing, insults, loaded comments, shouting, etc. should not be permitted, especially in areas of conflict. This is a key element to an interaction developing into a conflict situation with members of the Black community. So I've noticed that with police officers, when they're interacting with the Black community, how they communicate, they have already a bias in how they're talking. It's not logic, it's not kind of methodical in how in the language they're using. They will choose language to aggravate, and that shouldn't be done because that's not their job. If they've ascertained that law has been broken, it should just be carried out. Little side jabs of comments there is really unprofessional, and really someone should hold the person to account. So that's it, guys. That's it so far. Any questions on that?
Oh, if I may, I just wanted to jump in. There was just some interesting comments on the chat about what you were saying about other areas that could be added to the dossier. So talking about conscious and unconscious bias, belittling, microaggressions. I'm really sorry if I don't see any. I see all of them. We'll get through all of them. We are gaslighting as well, all being aspects or areas that have been suggested to. Yeah, that's all of them that I can see.
Yeah. All of those as well. If any of you have your own 20 questions or 50, well, not questions, 50 things that you think, please send it to BVL and we'll keep adding to this dossier, because we're looking to get funding to have someone turn it into a document that can be accessed. Hopefully, we're going to present it to the council really lovely and nicely. A dossier, and they'll be able to use it to implement their policies, etc. And anyone else who wants to have and wants to have a go at it, really. Yeah.
Great stuff, Michaela. I like that dossier. Really good. Okay,
Yeah.
we've got Sam North up to speak next. Sam.
Thanks very much. Sorry, my mute button wasn't working earlier. Thanks very much, Michaela. I think that's a really fantastic document you've pulled together there. For the benefit of people on the call who may not know, I am the Liberal Democrat Police and Crime Commissioner candidate for Hertfordshire in the upcoming elections. So in the event that I were to be elected, I would be in charge of setting the strategy and holding the Chief Constable to account. And clearly, the vast majority of things that you've said there would be pretty much implemented on day one should I be elected. But I just wanted to come in on a few of the perhaps additional things that might benefit sort of that dossier as well, and some of the things that I've been working with others in the Black community on developing sort of the manifesto going forward, and also attempting to sort of change the viewpoint that David Lloyd, who is the Conservative Police and Crime Commissioner, currently has. So one of the prime, and I could talk about all this all day, so I'm only going to say a very few points, but some that might be of interest. One of them is the actual use of force training that officers receive. Now, use of force is something that is incredibly important for police officers. I'm a former police officer myself. And use of force is something that you use every single day. But interestingly, and something that perhaps isn't as well known, is that police officers receive about 1 week of training in use of force in their basic training, and then only receive 1 day of refresher every year. And I don't believe that amount of use of force training is adequate enough to equip those officers to actually deal with those situations appropriately, in accordance with sort of Home Office guidelines and what they should be doing. So quite often, you're quite right, Michaela, some of the videos that you see on Facebook and on YouTube are of very, very bad situations, which very often have got out of hand due to a poor use of force by the officer, and how that use of force is being used. So one of the things that perhaps you might wish to consider adding is the frequency and the quality of the training that officers receive for use of force. I think one other thing that, well, again, as I say, there are lots and lots of other things, but another thing that is perhaps also interesting is I submitted a Freedom of Information request recently on the period of time it takes for the Professional Standards Department to investigate issues of professional standards. So the Professional Standards team are the team that investigate officers, basically. So if you've ever seen Line of Duty, it's the anti-corruption department. But interestingly, the average time and this is the average time, so there are investigations that could last a lot longer than this, was about 200 days. Now, 200 days is about 2/3 of a year, which is a very, very long time. And if you think about a person who's made a complaint to the police about the way they've been treated, if they then have to wait for 2/3 of a year, that isn't necessarily going to support them. And also it means that perhaps the Professional Standards Department are dealing with so many cases that often it can't deal with some of the cases that it's sort of with the same attention as perhaps they need to. So one of the other things that I think is probably a good thing to suggest is increasing the funding and the ability for the Professional Standards Department to act appropriately and to deal with the cases and the caseload that they have, whether that be increasing the size of the Professional Standards team, whether it be rationalising it across different forces. That's something very interesting. I'm going to try to rattle through, but I've got a couple more points that I wanted to make, which are very similar to that. Some of the other members of the Black community in Hertfordshire also felt that when it comes to the Professional Standards Department and the IOPC, which is the Independent Office of Police Complaints, if you actually have a look at the investigators who are investigating the officers, the vast majority of the time they are former police officers. And the real difficulty is if you claim to be, or if you have an independent office, it's very difficult to maintain its independence if the vast majority of those employees are in fact former police officers who on a fairly regular occasion may actually know the people that they're investigating. There was a specific incident that I know where one of my colleagues was investigated for a very serious issue, and the investigator was a friend of theirs or an ex-colleague. And clearly that is a real big issue. So another thing that I would perhaps suggest is ensuring true and proper independence of investigations when it comes to things like that. Body-worn video is a technology which probably everyone is aware of. A lot of police officers now wear body-worn video, which is basically a mobile camera. And when officers attend a scene, they should turn their body-worn camera on, and the rules currently in Hertfordshire state that they should turn the cameras on if they feel that there is going to be an incident. I don't think that's right. I think that the camera should be on as soon as the officers get out of the vehicle or are on patrol. I think officers need to have some element of privacy. So when they're in the police station, clearly there's no need to have the camera on. But I also think that if officers attend an incident and they didn't have a body-worn video on, that should be investigated as a professional standards issue, because clearly we don't know why that's not happening and why that isn't, why they didn't turn the camera on. And just finally, I know that, as I say, I could talk forever, but I know that other people want to talk. I think we all know the figure or we may all know the figure that you're 4.7 times more likely to be stop and searched as a black person in Hertfordshire than you are as a white person. And I think that one of the other real issues was actually in a recent Gets song, the fact that IC3, which is the police officer's radio communication for a black person, is very, again, stigmatized in its use. And if you, as a police officer, approach a black person and you're just carrying out a normal stop check, or you are searching them or even arresting them, every single time that black person gets stopped and checked or stopped and searched or stopped and arrested, they're hearing IC3, IC3. People around them are hearing IC3. And again, it almost becomes a subconscious way of placing a label onto someone. Rather than calling them Michaelia or Glenn or Sam, they are saying IC3 male, IC3 female 26. And I think that does add to the issues that are already present. And I don't at the moment have an answer to that. And I don't at the moment have an answer to how to provide a description, because descriptions are incredibly important. And I think that's highlighted in some of the experiences that I've had where the descriptions have been incredibly bad. And actually I've refused to deal with things because when the description is it's an IC3 male, there are lots of black males in this area. I'm not going to deal with someone and go and attend something just because you've said IC3 male. Are they tall? Are they short? Are they fat? Are they skinny? Are they bald? Are they what is the... So I could go on, and I'm more than happy to have a separate conversation with you. I've got loads and loads of thoughts and suggestions from other elements of the black community in Hertfordshire as well, which I'm compiling into my manifesto. But yeah, more than happy to discuss outside as well.
Have you spoken to the Watford community group?
I haven't spoken I don't know. I'm not sure I have. No.
Yeah, I think I'll send you his contacts. I'll ask him if it's okay, and it might be an idea, because they've been around for a while, so they'll be able to give you us babies here coming out, we just know for now, but they'll be able to contribute some good contributions as well. And I'd love it if you came back, Sam, and did a talk for us. It would be great to know the insights of the day in life of a police officer, because I think we just see it's difficult sometimes when I was doing those 20 questions to really see how to implement things. So I don't know what your day is like, because if I can understand what a police officer's day is like, I maybe can contribute a bit more. And I think not just me, I think others as well, to how maybe certain interactions and changes. Because one thing I did read your statement of what you're going to do after I read your article in the comment, I think it was on you or some other publication. It would be good to find out about institutionalized racism as well. I know it's a hard one to tackle. I know everyone's saying that, but it would be good to find out how that's going to be tackled, because all of that fantastic work you just said, and I loved everything, by the way, that you wrote there, loved everything. But it's like putting it in an environment that's geared to destroy it. And it would be nice to know that someone above is doing the same thing you are, so that everything that you do can flourish. Does that make sense?
No, I think you're completely right. And actually something that I wrote a letter to David Lloyd last week, because again, from the outcome of Freedom of Information requests, many of you on the call may know about the Macpherson Review and the Lammy Review. The Macpherson Review was a review conducted following the murder of Stephen Lawrence, and recommended 70 different recommendations for change that the police needed to implement. And the Lammy Review was of the wider criminal justice system, but that is also under the power of the Police and Crime Commissioner. And I asked Hertfordshire Police if they had implemented these recommendations, and they came back and said, we don't know. Now, clearly, if you took these things seriously, you would know exactly if you had implemented the recommendations of the Macpherson Review or the Lammy Review or both. So completely agree with you, Michaela. I think there are so many things that there are a huge amount of officers out there who genuinely want to do the best for every community out there. There are so many officers who are hugely supportive of the Black community and of all communities. But you are right in that a lot of them do get pulled into the institutional issues that are caused by police forces who do not implement appropriate strategies to deal with the root cause of issues. So I've spoken to you today about very operational issues, but I'm more than happy to talk about the strategic side of things as well if you wanted to.
Brilliant. And let's take the last 3-4 questions. I think we have 4 questions. And it's okay.
Okay. Yeah, we've got Sue. So if you'd like to unmute.
Yeah, just keep them quick.
Thank you. I'll just be really, really quick. But as the mother of a Black teenager, 21, tall and Black, I could probably list numerous things that have happened to him where he's been followed, stopped and searched and targeted by the police. So don't get me started on this subject. But I would like to see you come back and give us a talk, Sam. I'd like to wish you all the very best, because actually I think you'd make a great police and crime commissioner. So why don't you come back and talk about this subject? Because it's so important that Black children even shouldn't be followed and treated with suspicion, and that you know, so many times my nephew and my son have been stopped because oh, you fit the description. Well, what description? And it makes me so angry that just because he's tall and Black youth, you know, he gets stopped and asked questions about a stabbing down the road or something. So it makes me really angry, and I'd love to talk about it more with you. Thank you. And thanks, Michaela, because we've kind of gone off your, you know, dossier, but that's really important.
No, this is all going in the dossier, by the way. This is great. This is great stuff. Yeah, you can't buy this stuff. This is great.
Well, I do think things are brought to life by personal experience and example. So we can talk about, you know, figures and strategies and overarching kind of theories of things, but actual real life stories and experiences make it real and get people angry. And I know that's not always the best way to approach authority, but you know, we do need to be fired up sometimes to keep this moving and keep it going in the direction that it needs to go.
Yeah. Who's next, Una?
Okay, we've got Sonia.
Hello, everybody. As I said before, I live in Wiltshire, and many moons ago, I was the chair of Wiltshire Police's Race Equality Action Group. And I got my members, and we spent a whole shift with various police officers around the county. So I spent a shift starting at 6 o'clock, finishing at 6 o'clock the next morning, with a sergeant, and we never stopped. But it changed my ideas, and it changed me from stop being a challenging chair to being a listening chair, because there are two sides to a coin, and not all policemen are bad. Okay, we just have to wheedle out the worms. But I go to all of you here in Hertfordshire. Go to your local police station or speak to your chief and say you would like to spend some time at the police station. Do that, and then it will change your view. It changed mine. I still challenge them, but I see both sides of the coin.
Yeah.
And IC3, I hate that name. I really do. Because
sounds like some sort of disease.
Because just a few weeks ago, I was going to a farm shop. Okay, my car is paid for, it's taxed, insured, and I was followed by a police car. She was going the opposite way, and she turned around and came back. And I want to know why. What intelligence did she have on a 60-plus-year-old woman who walks with a walking stick, okay, going to a farm shop? What intelligence was that? why she followed me, because we passed her, but she was going the opposite way. But she turned around and came back and followed me. And then when she saw me get out my car and she saw where I was going, she looked, but I took her number. I took her number, the time, and I went to the chief constable. And I named and shamed. I'm not having that, because that could be my son. That could be any of the children that I am helping. I'm not going to have that. We're in 2021, not 1821, 2021. And people, no more. I'm fed up of this. Thank you.
Okay, next up. Thank you, Sonia. Yeah, we do. We get that totally, completely. Okay, next up we have Amy.
Thank you. I was just going to say about the whole kind of rhetoric that I think a lot of people use, that a lot of like police are good people, and I know, I'm sure some of them are really loving and, I don't know, great with their kids and take their dog out for lots of walks. But I think because the police, it's a racist system. So I think what happens is it's hard. I think you can't be a good egg in the police, because the whole system, it's intentionally designed so that you're not. I don't know if that's making much sense, but I think even if you are a good person, you know, you want to do the best, you go into the police, and the system, literally, it doesn't allow that kind of person to do good and to not discriminate, because the whole system is enforcing that. So it just trickles down. And I think it's just, the police is kind of breeding bad apples. It's like if you went to school and instead of being praised when you got an answer right, you got praised for getting an answer wrong. I don't know, that's the way I see it in my head, is that people are, because the system is flawed, it's just trickling down into everyone. So yeah, I'm sure there are, you know, good police, but it's not enough, because it's clearly them good police, it's not working. So I think a lot more pressure needs to be put on the system changing, rather than just like a few police, which I know is what the dossier and BBL and I'm sure Sam is going to try and do. But yeah, I don't even know if that made sense.
No, it does, Amy. I think we have to realise that Sam, when we read his, I don't know what you'd call it, his statement of action, I don't know. It was brilliant. However, he's just one man. You know, it needs everyone working as a team. Black, white, pink, blue, purple, everybody, because we are living in the same space and we're sharing the same space. So, you know, it can't be just him doing all this great stuff and there's people above him saying, you know what, I don't think that's cool, so I'm just going to carry on doing what I'm doing, which is actually a part of the problem. So it would be great if I don't know, actually I only know Sam who's up for it. I don't know who the other candidates are. It would be good if they are considering how they're going to work with the whole kind of system to make sure that this is not only implemented but protected. Because what we don't want as well is, for example, I don't know, Boris says, wow, this guy Sam North is great ideas, we're going to implement it and just reform the whole, you know, everything. But if no one's on board, even if the Prime Minister says it, if no one's on board as a team, it won't get implemented and it won't be protected. We're in the process at the moment of doing an action, which we won't announce now. We'll probably announce it at the next meeting because it hasn't actually been finalised yet. Which we're hoping Sam will help us with some information on. I think we emailed you, Sam, regarding just to find out on the issue of targeting. But yeah, it's now 10:03. Have we got all questions? Do you want to wrap up, Amy?
Yeah, thank you. Sorry, I forgot to lower my hand.
Very
And
upset.
also we have received a reply from Sam. It was just right before the meeting, so I forwarded that.
Okay, sorry, yeah.
Yeah, so just thank you to everyone who attended and contributed today. Also, just need to add into my goodbye message, you know, we are very sorry about the abuse that was encountered earlier in this meeting. It was outrageous, but this has been recorded. I don't know if those geniuses had noticed that, but we know exactly who they are. So, Black Voice
Amy, could I
Lecture
just
is-
mention?
yeah.
Could I just mention on that? What they did was actually an offence according to Section 4A of the Public Order Act. So they have actually committed a criminal offence. So if you forward this recording onto the police, they will be able to investigate it as such and prosecute where necessary. And that's a warning for anyone who thinks that it's a good idea to do that in the future as well, I suppose.
Thank you, Sam. So yeah, Black Voice Lecture is committed to actions. If you've been delegated an action or have any ideas, please follow through with that. The minutes and recordings of this meeting will be sent to you if we have your email. BVL has many volunteering positions available at the moment, as Michaela mentioned in the beginning. So this information will also be included in our next communication. We look forward to seeing you at the next meeting, and I hope you enjoy the rest of your evening and the weekend.
Thank you, guys. Thank you. We'll see you next month. Thanks again. Bye.